minutes. Okay, so let's go ahead and discuss the muscles that are going to move the head and neck. And let's do that. Let's stop the video. I don't want to see myself. I'm very, very self-conscious, and I don't want to see myself. Okay. So we're going to start off by talking about the muscles that we find in the front and on the sides, the anterior lateral neck muscles here. So keep this in mind. When we talk about these muscles, right, these muscles are going to flex the head and or the neck. Now, it depends on which muscles that we're talking about. So let's start off by talking about the sternocleidomastoid muscle. That's this muscle right here. Okay, you can see from the lateral view. This is the one that originates on the clavicle and the sternum, and then it travels on the lateral or the side of your neck up to behind your ear. And so when we discuss this muscle, right, when both muscles, both sternocleidomastoid muscles contract at the same time, that is called bilateral contraction. When both of them contract, we are going to look down towards the floor. That is called flexion, neck flexion. Now, if you contract just one, then what you're going to see is so for example, let's say you're going to contract your right sternocleidomastoid muscle. So that means you're going to get lateral flexion, all right, of the head to the right side, and you'll get rotation of the head to the left side. So I guess actually this would probably be a good use for me to show you this on the screen. So when I contract the sternocleidomastoid muscle, I'll kind of move in here a little bit. All right. Can you folks see me? Can you see my video? Is it showing up as a little box on the screen there? Okay, cool. I know the lighting isn't the best. So let's do the left side. So here's my, if you can't, it's tough to see, but here's the left sternocleidomastoid muscle. So if I'm just going to contract this one by itself, so left contraction or left contraction of the sternocleidomastoid muscle, it's going to cause me to laterally flex to that side, but then rotate to the opposite side. So think of it like this. I want to bring my ear to my sternum. So that's what SCM does, or sternocleidomastoid muscle. So it's just going to do laterally flex and rotate away. So this motion here, okay? That is going to be the motion of that muscle. A little bit. Okay, thank you. Thank you, thank you. Right, so that's when you have unilateral contraction of the sternocleidomastoid muscle. Here you can see it on the skeleton there. All right, the scalene muscles. Remember those? The scalene sisters. You got the anterior, middle, and the posterior. All right, these muscles will play a role in respiration, but only in certain cases. All right, that is in forced inhalation. Right, that would be somebody that maybe has emphysema, has some respiratory issues. They will use these muscles. Right, but when it's during forced inspiration, it will these muscles will lift and elevate the first and second ribs, because when you take a breath in, your rib cage expands. So with the scalene muscles here, I got off on a tangent. The scalene muscles, they're going to also flex the neck. And so they'll be on the lateral portion and a little bit on the anterior portion. So they're going to attach onto the transverse processes of some of the cervical vertebrae there in your neck. And then they'll extend inferiorly down towards the superior surface of your first and second ribs. So here you can see, right, parts of your scalene muscles. So if you notice, all right, the muscles are, I don't know, is that purple, blue? Okay, the muscles are going to be colored, and the other tissue that you might notice that's in the vicinity of the scalene muscles is this white tissue right here, or tan tissue, or whatever that is. That is nerve tissue. Okay, that is nerve tissue. And we'll learn about in later chapters what those structures are, but that's going to be part of what we call the cervical plexus there. That's going to be all these nerves that are exiting out of your neck and going down into your arms. So you'll see one particular nerve right here that is sitting on top of the anterior scalene. Here's the anterior scalene, and then you can see this one nerve right here. And so that is called the phrenic nerve. The phrenic nerve innervates your diaphragm. So you can see how the scalene muscles are attaching onto the first and second ribs. So they'll elevate and lift the first and second ribs up when you're trying to take a very, very, very big, deep breath in. So here you can see this nice view of all those different muscles. Here's the sternocleidomastoid muscle here. And then you can see your scalene muscles off to the side over here. All right, now let's talk about the muscles that are on the back of the neck. For the most part, if the muscles are on the back of the neck, they are going to extend the head and or neck. So that's basically saying, all right, look up towards the ceiling, or if you're bringing your chin down to your chest, then you just tell the person, okay, go ahead and look straight ahead. That's going to be extension of the neck. So the trapezius muscle, remember that's that big diamond-shaped muscle on your back. But when we talk about what it does for movement for the head and neck, we're only going to be referring to the upper fibers there. Okay, there's three parts to the trapezius muscle. You have the upper, middle, and lower fibers. The upper fibers are going to help extend the head and neck. And they do so, it helps to also move the pectoral girdle. Remember the pectoral girdle? That's going to be the scapula and the clavicle here. So for the upper fibers of the trapezius muscle, that's going to help you to, if your head is flexed, to look straight ahead, for example. All right, Splenius Capitis. Our Splenius Capitis muscle, this is going to be a muscle that's on both sides. So when we contract both sides together, we are going to extend the neck. If we contract just one of them, like the right, then we are going to turn the head and neck to the same side. So if I'm contracting the right one, that means I'm going to turn my head and neck to the right side. So here's the trapezius muscle. The upper fibers help to shrug the shoulders. So when we talk about the pelvic girdle, excuse me, not the pelvic girdle, the pectoral girdle, when you're doing shoulder shrugs, you are manipulating and moving that keep wanting to say pelvic, that pectoral girdle there. There's the trapezius muscle. Here you can see it on the back. All right, we're talking about extension of the head and neck. We're referring to the upper fibers there. All right, that will actually pull the head back a little bit. There's the Splenius Capitis. All right, so you can see if we contract both of them, they'll extend the head and neck. If we're just going to contract the right side here, then it's going to cause you to turn your head and neck to the right side. All right, so what neck muscles flex the neck? The anterior lateral neck muscles flex the neck. That's going to include the sternocleidomastoid and the scalenes. All right, so if any of you have ever heard of congenital muscular torticollis, it's an actually really interesting condition. I had a case last year. No, I take that back, 2 years ago. That was my most recent one. I had several when I was practicing up in New York. And these parents brought their baby in. I can't remember how old she was. I want to say she was anywhere between 2 to 6 months old. But basically what will happen is, as a result of a vaginal childbirth, because usually a vaginal childbirth, okay, so you're so, and then there's a difference between torticollis and congenital muscular torticollis. okay? Because torticollis is just anything that has to do with your neck being in a funky position. That can happen in adults and whatnot. Kids too, obviously it happened to your son. But with the baby here, the congenital muscular torticollis is telling us that this torticollis is a result of actual muscle spasming going on. And it's usually something that you get as at birth. And so because of the birthing experience, right, or something that occurred during birth, all right, what had happened is we've seen that one of the sternocleidomastoid muscles have become shortened. So of course that child then, well, if it's the right sternocleidomastoid muscle, they'll be tilting their head to the right side, but looking off to the left. And so what we did is, yes, we definitely recommended physical therapy. We did some manipulation and some muscle work. Actually, it wasn't too difficult with this child. You do some behavioral modification. You know, if you're trying to feed the child with a bottle, force them to look to the opposite side. All right. And so you just try to focus more of that attention there to kind of lengthen that shortened sternocleidomastoid muscle. I'm not going to give a child a Botox injection unless it's absolutely imperative. If everything else has failed, then I would use Botox. There you go. See, girl? See, now you can say that this class was worth it. You can say, all right, I'm getting some of my money out of this class. Glad we could help you out. But basically what we do is we just rehab the muscle and lengthen it so you're no longer having that tilted position there. Okay, so let's now, staying within the axial skeleton, we're going to move a little bit more inferiorly and move down into the vertebral column here. And so we talked about the muscles of the head and neck. So let's now talk about some of the muscles of our vertebral column. And so there's going to be several. I'm going to do my best. We're not going to go through every single one, but we're going to talk about quite a few. One of my favorites are the Erector Spinae muscle. Last class, I told you these are the deepest muscles that sit on the back, well, on your back, right? On top of the spine and off to the side of the spine. Now, their main job is to help maintain posture. So as I'm sitting here with you, if I was standing, I would be stimulating these muscles and they would be contracting to maintain my upright posture. Now, if I go to bend over and flex the vertebral column, when I go to straighten up, right, I am going to contract both sides of my Erector Spinae to extend or straighten up. If I lean to the side, I'm standing straight up, okay, and I put my hands to my sides and I slide my right hand down my right leg past my knees. I'm doing a side bend there. Right? I am contracting my right Erector Spinae muscle. Right? So if one side is contracting, I'm going to go into lateral flexion to that same side. We call that ipsilateral lateral flexion. Ipsi means same side. Contra means opposite side. Okay. So if we contract both of the Erector Spinae, I'll extend the vertebral column. I'll straighten back up if I'm bent over. If I want to laterally flex and stimulate just one Erector Spinae, I'll lean to one side or the other. So here you can see the Erector Spinae muscle. We used to call this the I love spaghetti muscles because there are different divisions here to the Erector Spinae muscle. We don't have to know them, but you can see how they lay right across your back. And they go basically from the cervical spine here all the way down to the superior portion of your sacrum. So they play a huge role, okay? All right, some of the other muscles in the vertebral column, the Quadratus lumborum muscles. If you recall, these muscles are down in the lumbar region of your spine, right? They are going to be lateral to the psoas major muscles. Now, again, they're square-shaped muscles, hence the name Quadratus for the, I shouldn't say square, but for their four-sided shape there, and the lumborum as to their location. Similar situation to Erector Spinae. If we contract both of these muscles, the right and the left, we'll again extend the vertebral column. So if you're bending forward and you go to straighten up, you're going to contract these muscles and they'll extend the vertebral column to bring you upright. These muscles are postural muscles too. You're engaging them quite a bit in sitting and standing. Now, if I ask you, all right, I want you to do a side bend to the right, then you'll contract the right quadratus lumborum muscle and you'll lean to that side. You'll have that unilateral lateral flexion going on. Okay, so here you can see, here's the psoas major muscle. We just go lateral to that, and you can see the quadratus lumborum muscles and how they attach onto the iliac crest here of your pelvis and then onto your 12th rib there. And so if you bend forward, you'll contract both of those to straighten back up. If you want to lean to the left side here, you'll contract the left quadratus lumborum muscle. If you want to lean to the right here, then you'll contract the right quadratus lumborum muscle. Right, here's a nice drawing of some different muscles. Here's part of the Erector Spinae muscles right here. And so like I told you, that they break down into different divisions. We used to call this the I love spaghetti muscle. I for iliocostalis, love for longissimus, and then spaghetti, spinalis. That's how I remembered it. I love spaghetti. But anyways, so we'll see these deep muscles. And then we got another group of muscles. Well, let me go back here. That sit on top of those. These are the serratus posterior muscles. We talked about that. We labeled these muscles the serratus posterior. Now there's a group that's in the thoracic region. There's a group in the lower thoracic region, in lumbar region. And so this is the superior group. This is the inferior group. But this brings me to talk to you about the muscles of respiration. Now, you'll talk about this a little bit when you get into the respiratory chapter, but I do want to just briefly talk about some of these muscles so you're not going to be overwhelmed with all the material in 211. So when we talk about respiration, we were talking about the process of breathing in, which is called inspiration, and breathing out, all right, which is expiration. So when we're dealing with inspiration, what we're going to see is we're going to see the contraction of several muscles. Yes, mainly the diaphragm. There's going to be some others like the external intercostals, which will help. All right, we'll get into that in a moment. But when we do that, we're going to increase the dimensions of your thoracic cavity. And so how we do that is when you take a breath in, your ribs will lift out and up like a bucket handle. So if you've ever had to pick up a pail of water, when you go to grab the bucket handle and you lift it up and out, that's what happens to your ribs during respiration when you're breathing in. Then when you breathe out, we're going to relax some of these muscles. The ones that you contracted during inspiration, you'll relax. And then you will contract some other muscles during expiration. But really, expiration is a relatively passive process. We consider it relatively passive. The only real active part of respiration is breathing in, is inspiration. Okay, so when you're exhaling, you're going to return your thoracic cavity back to its original dimensions. So we're going to decrease those dimensions, all right, of the thoracic cavity that we just recently increased with inspiration. All right, so when we're talking about some of these muscles, serratus posterior, superior, and serratus posterior, inferior, those are these muscles. Here's serratus posterior, superior. Here's serratus posterior, inferior. Those are the muscles that we're talking about. Okay, so when we're talking about the superior group, you'll notice they will attach onto the upper ribs, 2 through 5. Okay, you will utilize these muscles, and some of these muscles that we're going to talk about, we'll talk about utilizing them during forced respiration or forced inspiration or forced expiration. So you'll utilize these muscles when you're trying to take a real big deep breath. Serratus posterior inferior is going to help pull the ribs down. That's what happens during expiration, but this happens during forced expiration when you're trying to blow a breath out, like when you're blowing out candles or something like that. And then, of course, our scalene muscles will also be utilized to elevate ribs, the first and second ribs, during forced inspiration. All right, so here you can see serratus posterior superior and serratus posterior inferior. So it's real simple. If you look at this, I like this drawing a little bit better. Okay, if we're going to contract these muscles, we're going to shorten these muscles. You can see they're going to lift these ribs upwards. And then if we're going to contract these muscles down here, you can see they're going to pull the ribs down. So up and out equals inspiration. Down and in equals expiration. Here you can see those scalenes again. All right, so some of the muscles of regular breathing, okay, are the external intercostals and the and the diaphragm, which we'll see here in a second. Okay, so our external intercostals, all right, we saw those. Those are going to connect, all right, adjacent ribs to one another. And so basically they're going to go from the superior rib down to the inferior rib. And the fibers are going to go what we call inferior medially, which is basically, like I said, putting your hands into your front pockets. All right, they will move medially but downwards. And so they'll help raise the ribs when you are breathing in. Okay, our internal intercostals, right, they go to at right angles to the external, right? So they're going to also go, I'm trying to think, if those are going inferior medially, these will go inferior laterally, all right? So they'll go almost like down and out. And so these these muscles will contract, and that will pull the ribs down during forced expiration. Transversus thoracis, remember those muscles that were going straight across and connecting onto the ribs? Again, we'll see them being utilized to pull the ribs down during forced expiration. All right, so there's the external intercostals. Here are the internal intercostals. All right, you'll go through all this again when you get into the respiratory chapter. And then finally, our diaphragm, our main breathing muscle. This is the one, okay, that does pretty much all the work during inspiration. So what will happen is, all right, when the diaphragm is relaxed, it's going to have this big dome-like configuration. So when you go to take a breath, it'll flatten out like that. That increases the dimensions of the thoracic cavity. And you'll get into that because it's going to change air pressures and all that fun stuff. And so again, that's something to look forward to next when you take 211. So there's three openings. We have the caval hiatus, the esophageal hiatus, and the aortic hiatus. I already talked about what all of those are for. Okay, caval hiatus is for the inferior vena cava to make its way to the heart. Esophageal hiatus is for the esophagus to make its way down into the stomach. And then the aortic hiatus is for the descending aorta to make its way down into the lower body, into the abdominal cavities there. And there you can see our diaphragm. All right, blah, 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 blah. Let's talk about the muscles of the abdominal wall real quickly. Okay, some of these muscles are part of what you would consider to be core muscles. And so these muscles of the abdominal wall will help to support the abdomen, offer some protection. So they'll help to hold some of these organs in place, but it actually will offer a fair amount of stabilization to the vertebral column. All right. So the first muscle, the most external muscle here on the abdominal wall in the lateral portion is the external oblique. These muscle fibers go down and in or inferior medially, okay? And so when we get closer to the front, because the external obliques are more so on the side, when we get closer to the front, the muscle fibers disappear, and what's left is this structure called the aponeuroses. Aponeuroses is like a thin tendinous sheet. It's made out of, it's like a tendon, similar to a tendon, but it's really thin. Okay, tendon is made up of dense regular connective tissue, and aponeurosis is made up of dense irregular connective tissue. And so what will happen is the aponeurosis will move, I'll show you a picture here in a moment, all right, is going to join with the other aponeurosis from the other side's external oblique, But more importantly, as we move inferiorly down towards your groin and towards your leg, okay, this aponeurosis is going to form what we call the inguinal ligaments. And this has to do with hernias and all that fun stuff. So here's our external oblique. And so you can see here, here's the muscle tissue, and the fibers are running down and in. But as we get more towards the front, the muscle fibers stop, and we're left with this aponeurosis right here. And so the right external oblique aponeurosis will fuse with the left external oblique aponeurosis here at the center. If you remember what this structure is, that's called the linea albia. It's that line right in the middle there. But as we go inferiorly, the aponeurosis will turn into what we call the inguinal ligament. And the inguinal ligament, right, covers this canal here. It's called the inguinal canal. And in males, all right, your spermatic cord is going to travel through the inguinal canal because it's going to connect the scrotum of the testicles, all right, to the internal reproductive organs in the male. In the female, the round ligament, you'll learn what that is in 211. The round ligament travels in the inguinal canal there. All right, the internal oblique, which is just going to be deep to the external oblique. All right, this one is going to have its fibers perpendicular to the external. So those fibers from the internal oblique are going to go up and in. Right, I don't know how people say that it's like putting your hands into your back pocket. I just don't see that. I mean, your back pocket, your fingers go up and down. So I never really understood that one. Okay. But the internal oblique muscle fibers are going to be perpendicular to the external oblique. So they're going to go up and in superior medially. And it has its own aponeurosis. And the same thing will happen with the external oblique that happened with the internal oblique. All right. The muscle fibers will stop as we get into the front there, and it will then transition into that aponeuroses, which will then connect with the aponeuroses from the other internal oblique. Then deeper to that is the transversus abdominis muscle. This is the deepest one. And it also has an aponeuroses, same scenario. All right, with this one, the aponeurosis is going to form anteriorly. And the fibers for this muscle tissue, like I said before, last class, goes transversely from side to side. So here you can see the internal oblique. Now the problem is with this picture, we dissected away, okay, part of the aponeurosis for the internal oblique. You can see the internal oblique muscles here, it ends, and then the aponeuroses would be in this area here. All right, then here's our transversus abdominis muscle. You can see the fibers going across. Internal oblique muscle fibers go up and in. And so here's that aponeuroses for the transversus abdominis. Okay, so when all three muscles contract together, all right, on one side, we're going to get lateral flexion. All right, if we contract the muscles on the opposite side, it's going to cause us to rotate and twist the vertebral column. Okay, so if we contract the right external oblique, internal oblique, and transversus abdominis, we'll get right lateral flexion. All right, so here you can see all the muscles together. And then don't forget about our rectus abdominis muscle. That's six-pack muscle there. Okay, that's parallel muscle fibers. Right, and it goes, all right, the entire length of the anterior portion of the abdominal wall. So we're familiar in between the muscle bellies, we have the tendinous intersections there. But what I haven't talked to you folks about is this structure here, what we call the rectus sheath. It's a fibrous sleeve. All right, and the fibrous sleeve is formed from all of those aponeuroses that I just talked to you about a moment ago concerning the external, internal oblique, and the transversus abdominis. So we're going to see here how some of those fibers are going to go on front of the rectus abdominis, while others go behind the rectus abdominis. So here's our rectus abdominis. Right, you can see where it is. And then you can see here our tendinous intersections. And then you can see this rectus sheath here that covers the rectus abdominis, and where the aponeuroses from those internal, external obliques and the transversus abdominis meet, they meet right here on our linea albia there. And I want to say I've got a good picture to show you. And I thought I did. Oh, I guess I don't. All right, anyways. And then finally, let me just tell you about hernias. Some of you may be familiar with hernias. Okay, when we talk about a hernia, there's different types. So you can have a disc hernia. Remember, the intervertebral discs have that jelly donut type of consistency. All right, this is a different type of hernia. This is when some viscera, could be some of your intestines, can actually protrude through a weakened spot on the abdominal wall. So there's a couple places that you can have these hernias. You can have an inguinal hernia right around the belly button. I've seen a couple of those in my day. You can have an inguinal hernia. Oh, shoot. You can have an inguinal hernia, which is down here. You can, oh no, believe it or not, I know what I'm doing. All right. You can have some viscera protrude into the inguinal canal, and it will actually exit down here where in males where the spermatic cord enters into the inguinal canal. That's why for sports physicals, all right, if there's any males that have had a sports physical, you know what I'm talking about. In some cases, yeah, it depends on how badly the hernia occurs. So some doctors, when I say they cheat, they'll take a flashlight and they'll flash the light at an oblique angle on the skin there. And if there's a shadow there, a slight shadow, it's usually indicative that there's a hernia protruding. It's similar to a prolapse. I wouldn't say it's the same thing. Okay, a prolapse is where you're going to get something that's itself kind of poking out. Like, if you probably heard of a prolapsed uterus, or you can get a prolapsing of the bladder. Also, I know with some dogs you can get a prolapsing rectum. But basically, it's when these structures that are relatively close by to the vagina or the anus will actually protrude out through those openings there. So in this case, when you have these hernias and they ask, if you go in for a sports physical, they'll ask you to cough. And what will happen is when you cough, you're increasing the pressure, and usually it'll move those weakened viscera, or not the weakened viscera, but it'll move the viscera through that weakened opening there in the abdominal wall. So yeah. And then there's actually a femoral hernia. That's more common in women, and when we get into the appendicular muscles, I can talk about that. But usually we have the umbilical hernia, and then you have the inguinal hernia, and then there's two types of inguinal hernias. One's called direct, and the other one's called indirect. And it can get pretty bad, so much in some males where the hernia can actually extend down into the scrotum. And so if you're having that happening, that's something that you should have taken care of a long time ago. All right, and then finally, the muscles of the pelvic floor. You ever wonder why your guts just don't spill out of your body when you're sitting? Okay, it's because of the muscles of the pelvic floor, which we call the pelvic diaphragm. All right, there's several layers there. Okay, I'm not going to go through all the different muscles per se. There's like two that I want to point out to you. Okay, but their job is to help hold in all of the organs there of your pelvic cavity, so that things just don't go spilling out. Now, the term perineum is this term that we use, all right, when we're looking through, and I don't think I have a picture. Oh, I do. Okay, here you can see, all right, when we're looking at our perineum, from this angle, this is a superior angle. I'm used to seeing it from the inferior angle. basically from the coccyx out to the ischiotuberosities, then back over to the pubic symphysis, you have this kind of configuration there, right? The perineum is that diamond-shaped structure. I just kind of drew it, but it involves drawing a line from the pubic symphysis to one ischiotuberosity, then from that ischiotuberosity to the coccyx, then from the coccyx to the other ischiotuberosity. Right? And so basically that perineum is going to be that area, right, in that space that I just described to you. And the two major muscles that I want to talk about are the coccygeus and the levator ani. The levator ani plays a really big role because this is the part that makes up the front and the lateral portions of the pelvic diaphragm there. And the levator ani muscle plays a role in when you're learning how to toilet train. This is the muscle group that helps with that, right, in order to control the flow of urine here. Right, coccygeus also helps to make up that pelvic floor, and that plays a big role in holding in your guts. Okay, so that's what we're seeing here. Here's the levator ani muscle group, and then you can see that's made up of the iliococcygeus and the pubococcygeus, and then you have coccygeus, which makes up the remaining portion of your pelvic floor. Okay, we don't consider, there's the piriformis muscle. We'll talk about piriformis later. Okay, but not to worry. But so you can see the levator ani and the coccygeus, all those muscles, because all of the pelvic viscera sits right on top of this area here. And that helps to hold everything in. All righty, I told you this wasn't going to take long. I don't know what was going on with me, folks. I